topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Milwaukee. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. Have we got a great show for you today? The reason why I say it's a great show, we received your emails requesting, why don't we do a show in Milwaukee on neuropathy? Now, Ask the Experts does neuropathy shows across the country, but we did not have one for our Milwaukee audience, and now we do. We got one of the finest specialists in that area. Let me welcome our new expert, Dr. Kurt Simmons of the Disc Centers of America. Good morning, Kurt.
Good morning, Steve. How are you?
I am so glad that you are now part of the show because I have learned how serious neuropathy is and how painful it is and all the side effects, people losing their balance and people, there's so many people walking around right now wondering, why am I having this numbness? So first of all, tell us, Dr. Simmons, about your and I called you Dr. Simons, about your practice, Disc Centers of America.
So yeah, we started, I've been in practice now for about 30 years, Steve. For the first half of my years in practice, I probably spent doing a more traditional chiropractic clinic. But now we specialize in niches. We do non-surgical spinal decompression for bulging and herniated discs. We treat it non-surgically. We've also gotten into neuropathy because the neuropathy treatments that are out there are not effective. It's quickly becoming an epidemic in our country. The number one cause is diabetes. As diabetes rates go up, neuropathy cases go up. There are other causes and things that contribute to it as well, but we're always looking at Disc Centers of America for things that we can do outside of the box, ways that we can actually help people get back to health instead of just using the traditional approach of medication to cover up the symptoms.
I got to tell you, I am so blown away where the field of chiropractic care has come. It used to just be auto accidents. You guys are so far ahead of that. The things that you're doing now are just amazing. And my hats are off for what you're doing. And this is one of those areas is neuropathy.
It's been fantastic, Steve. It's given us a new outreach to help people in ways that, most people aren't even aware of. I'll get patients that'll be referred in. They're like, I didn't even know you guys did this stuff. And, one of the ways of getting the information out is doing things like this and, just making people more aware that there are more options other than just, here, take this pill and hope it works.
What made you get into studying and practicing neuropathy?
I had so many patients that, when we treat them for low back conditions, a lot of them would have the same symptoms of neuropathy, whether it was neuropathy or it was something else. And, in talking to patients who had neuropathy, listening to them as far as what they're going through, how it's being treated. And most of them, will tell me that, well, I'm on gabapentin. And it seemed to work really well for the first 2 weeks, 2 months, 3 months. But now, I don't even know why I'm taking it because it doesn't seem to make any difference. So we wanted something that, there's got to be more to it because what they're doing medically is just not working for it.
Exactly. Dr. Simons, every time I hear about, especially an older person falling, now that I've done so many shows in other markets about neuropathy, that I know that you lose your balance with it.
You can, yes. As it progresses, there's a lot of different symptoms. You can have most people the thing they equate to and most that they experience first is pain, numbness, and tingling. But neuropathy is a condition it's a breakdown of the peripheral nervous system. If you think about a wire that you have in your house, they've all got that colorful coating, that insulation on the outside of it. And with neuropathy, what happens is you've got that myelin sheath, which protects that nerve. That starts to break down. So that nerve is still conducting and firing. But if you think about a wire in your house that doesn't have that insulation on it, it's going to short circuit. It's not going to work as well as it should. And there's a big part of balance that is what's called proprioception. Now, if you close your eyes, most of us can close our eyes and we can stand in place without falling over. That's proprioception. It's your body's ability for the brain to communicate with the feet, know where you are. When you start to lose that communication, that can affect balance. And when you start to lose balance, you start to get falls. And then you're talking about things like, fractures and other things that become, very dangerous as we get older.
So I know there's people who are listening right now are going, okay, so what are some of the symptoms of neuropathy?
So again, kind of to reiterate what I had said before, you can have the pain, numbness, or tingling into the arms or hands. Neuropathy almost always is bilateral, meaning that the patient will have very similar symptoms on both sides. We see it more commonly in the feet than we do in the hands, but it does happen in both. You can get muscle weakness. In the feet, you get some foot drop. You start dragging your feet. Again, that can contribute to the falls. You can have trouble feeling things, whether it's hot, cold. If you step on something sharp, you may not notice it. Something clinically that we'll find is loss of reflexes or decreased reflex, maybe on one side or both sides. And that, you can get, when it gets more advanced, you can get changes in the skin and nails. You can get sleep disturbances. And we had touched on before, balance is a big issue as it progresses.
There are people I've learned, there's so many people out there that suffer from these conditions, but they just blow it off. Mm-hmm. Tell people what happens if they don't treat neuropathy.
With neuropathy, it's going to just continue to progress. It's going to get worse. And unfortunately, even with the medical symptoms, the medical treatment, the most common approach that I see right now for patients that come in is gabapentin. Gabapentin is an anti-seizure drug. So it's something that it's being used as what they call off-label to treat neuropathy. And it really doesn't, best case scenario, it covers up or minimizes the symptoms over the short term. But the long term, it doesn't do anything to treat the cause, which is why most patients, after a while, they've been on it, they're like, it doesn't seem like it's making any difference. And a lot of them will tell me, I don't like how it makes me feel. I don't feel like I can function normally. It messes with me cognitively. So sometimes I don't, I'm not sure I'm all there and I don't want to keep taking it.
Can neuropathy be cured?
No. Neuropathy I always tell patients it's a long-term chronic condition. The only neuropathy cases that I've ever seen resolve completely, and I still wouldn't call it a cure, are chemotherapy induced. It's a very common side effect with chemotherapy. Most doctors will tell their cancer patients, well, you've got the neuropathy symptoms, just give it 3 to 6 months and they'll go away completely. A lot of times it doesn't. But the most common cause is diabetes. And diabetes, for the most part, when you have it, it's something you're going to have to continue to manage for the rest of your life. So what we look for in our patients with neuropathy is, can we stop the progression? And in some cases, can we reverse the progression so their symptoms become even less and get better? And then what do we need to do to teach the patient to maintain that? Because I always tell patients, there's a lot I can do for you in the clinic. And most of what we do in the clinic, you're not going to want to do at home because it's not cost effective. But there are home portions that we can get the patient to do. And there's varying different levels of that depending on, what the cause of their neuropathy is. So it's, for the most part, I tell patients it's something you're always going to have to manage and live with. It's just a matter of, can we teach you how to do that?
But I have heard that if not treated, you could actually, in the long run, you could actually lose toes or feet.
Well, if you think about it, the nervous system runs everything in the body. And if the nervous system starts to break down and those messages can't be relayed, you can start to have, on the very bad end of diabetes and neuropathy, you do end up with amputation,
Right.
and things like that, and infections that become very hard to manage and very hard to cure. Even, medically, they have a hard time with those. And if you can stop that progression and reverse it, in most cases, if the patient's willing to work on it, you can prevent that. The hard thing for me sometimes that I run into is we'll get patients in because most of the treatments that we do, they're not covered medically, so patients are paying out of pocket.
Right.
And I'll get patients, they'll be like, well, why would I want to do this when I have to pay out of pocket when my insurance will pay for this? And I just tell them, I'm like, well, what you're doing that your insurance is going to pay for isn't going to help you. And you'll find that out in the long run. But it's just a question of, what is your health worth to you? Because our healthcare system in this country is broken. It doesn't focus on health. It's all about medication. What pill can I give you to change your condition rather than how can I teach you or how can I help you to change it so it goes away?
I am so upset with the insurance companies. And this is like one really good example. Here's a symptom that if insurance would cover it now, it would save these insurance companies so much money in the long run. Don't you think?
It does. It seems diametrically opposed when you think about it, because yes, it would. And I always tell patients that the problem with our healthcare system is it's run by the pharmaceutical companies.
Yes.
I don't fault the doctors. They work in a broken system. They're in a system that's just fraught with problems. And their hearts are in the right place and they're doing the right things, but it's just, it comes down to the money. And with drug companies, they're more concerned about profits than they are about the actual health of the patient.
This is our 15th year of Ask the Experts, and I have seen all types of physicians. And I am seeing more and more physicians that went to medical school, did an internship, residency, who are now moving away from medicine, going more to functional medicine, because everything they learned in many of the things they learned in medical school does not help them today. And that's why I think chiropractors are so far ahead of the curve. So if, let's just say, I want to come in, make an appointment, what's the first thing you do to see if they do have a neuropathy problem?
So an average visit for the first time a patient comes in, the first thing we're going to have them do is fill out a comprehensive health history. And with neuropathy patients, it's a little bit longer, a little bit more involved, because we want to dig into their past. We want to find out what medications they're currently on, what conditions they may currently have. And then when they're done with that, I'll sit down with them and we'll talk about it. We'll go through everything, review it, make sure we've got all the information we need. And then in the office, we'll do a neuropathy evaluation. And we're going to test, for example, most patients, it's lower extremity. So we're going to check different types of sensation, whether it's hot, cold, fine touch, 2-point discrimination, muscle strength. We even do an infrared picture to take a look at, vascularity. We'll measure skin temperature. And basically we want to coordinate everything because they're coming in saying they have neuropathy. We're going to look at their history. Yeah, that points towards neuropathy. Yeah, the evaluation confirms, yes, I do think you have neuropathy. And then it's a question of, what's going to be the best approach to treat you. So I always tell patients the primary thing I'm concerned about when you come in is that we get the right diagnosis. Because if we have the right diagnosis, then we can structure the treatment to be the most effective we can. And I always tell patients too, if I can't help you in my office, I don't want you in my office, because I don't want you to be frustrated. I don't want to be frustrated. But if everything points to, yes, you have this, and I think we can help you, then we'll talk about, what the different approaches are.
Are there any supplements that you think people should take?
I don't give out specific supplements because especially with neuropathy, you get, again, most of the patients are diabetic. So
Yes.
our programs will go from the basic to very involved, depending on what the patient wants and what they're willing to do. A lot of patients just aren't willing to make a lot of dietary or lifestyle changes. And with them, we'll give them just some basic supplementation to help increase nerve function and help the nerve heal. But for patients with real serious metabolic disorders, I always tell them we can do all the in-clinic stuff, we can have you do all the home stuff, but if we don't really get in and change your diet and your lifestyle, you're probably not going to get a whole lot better. Because the easiest thing I can equate it to for a patient is everything that I'm doing in the clinic and all the basic home stuff we have you do at home is all external. It's really not doing anything internally. But if we can get in and start to change your body inside, then we can give you a much better outcome long term. And I tell patients there is no easy button. This is a condition that in most patients has developed slowly over a number of years, and it's going to take time to go away. But if you're willing to put in the time and the work, we can get you to where you want to be rather than just, I got to just take this pill to manage this the rest of my life.
What else could a person's symptoms be besides neuropathy?
So, anything related to the nerve, could it be a pinched nerve somewhere throughout the distribution of that nerve? Could it be a bulging or herniated disc coming from the lower back or the neck if their symptoms are in the hands or the arms? Could it be, chemical related to their diet, their lifestyle, where they work? Could it be related to the medications that they're on? Many times patients will be on 10, 12 different medications. And when you start to go through and break those down and look at the side effects, then if that's the case, we'll talk to them about, talk to your doctor about some of these and see what his thoughts are, or talk to your pharmacist, because all those things can contribute.
So how does inflammation from spikes in blood sugar actually kill nerves?
So when you've got insulin resistance, which is what's common with diabetes, it can affect the coating, that myelin sheath around the nerve that insulates the nerve. It can cause that to break down. It can affect the body's ability to carry oxygen, which the flow of oxygen in the bloodstream is essential to health. So that's the biggest ways that will affect that.
We just got our first text. I am one of the ones who wrote you about starting a show like this. I'm so glad there is a show out there, and now hearing that there are ways that possibly could cure neuropathy. What is some of the things you would do at home that you don't do in the office?
At home, there's the basic things that we'll do is we send you home with some red light therapy, some boots that you can use. You can use them on the hands as well. We use vibration therapy. There's two aspects of that. One is basically just sedentary. And as you improve and start to get better, there's actually exercises you can do on the vibration plate. Again, it helps with the stimulation of the nervous system, getting things to function properly. And then, like I said, we do everything from just some basic supplementation to give you some additional support to full-blown metabolic programs, if that's something a patient's willing to work on and interested in.
So how good, I guess, what is the success rate if someone does everything you'd ask them to do, either in the office or at home?
Steve, and I hate to give a blanket answer like this, but for patients that follow our program, I haven't had anybody that's done the program and stuck to the program that hasn't been happy with the outcome.
Wow, that's amazing.
Now, I'm not going to say that everybody's resolved completely,
right,
because you never know where people are at when you get them in. And I've had some patients, it's taken them, 6 to 12 months to really get where they want to be. But most patients, if they follow the program and do what we tell them to do, they're going to be pleased with the outcome that they get.
So how much of the program is in your office versus at home?
So most of the time with programs, in office is going to be twice a week for 12 weeks. So there's about 3 months of in office. But they're also going to be doing the home program at the same time. We start them on the home program right away for a couple of reasons. Number one, to make sure they know what they're doing, they're comfortable with it. But number two, then they're not only getting treatment twice a week in the office, they're getting treated every single day. And the more treatment we can give them and the more they can do at home, the quicker they're going to start to see positive results. And with the home treatment, if they've got time, for most patients, it'll take an hour to an hour and a half to do their home treatment. And I tell patients, if you've got time, do it twice a day, which, for somebody who's working full time, probably not as practical, but a lot of my patients are retired. And they're like, well, I watch the news in the morning for an hour and I watch, my 2 shows at night. So I can,
Right.
I can do it while I'm sitting in the recliner, and that's perfect.
I have to add this to the show. Dr. Simons, you might know about it, but there's a lot of scams out there. We're finally discovering that there's a lot of people who have neuropathy that have been untreated. And because of that, there's a lot of scams out there. But I got to tell you, there's a huge scam out there. I'm not going to use names, but he's a high profile, has a TV show that said he's got a pill that will cure neuropathy. I don't, are you?
If he does, I can start using it. Steve,
what's that?
If he does, I've got to find it so I can start using it. But
I've read a lot of the everything on Google, and there's a lot of unhappy people that felt like they were misled. And I know you know what I mean.
Yeah. I mean, with neuropathy, you could take our program and probably break it into 6 or 7 different parts. And what I found over the years is that if all you use is one part, you just don't get the results that you get when you do a full program. I've never found one. I've had some patients, they'll take one supplement. Now, I've been taking this and I've noticed a big difference. It worked really well. And you get 6 other patients who are like, well, I took that and it didn't make any difference for me. So everybody's going to respond differently. And I always tell patients, if you're going to buy something like that, ask them if they, give you a 60 or a 90-day money back guarantee, because chances are it's a sales pitch. The sales pitch always sounds good. But most of the time, if you start to read the reviews and dig into it, I haven't found any one thing that, makes that big of a difference.
Well, disc centers of America are all over the United States, and it has such a great reputation. Why is it, and again, I've been doing this for a long time, why is it that chiropractors have had more success with neuropathy than people who went to an MD?
The easiest answer for that, and it's not even so much because I'm a chiropractor, it's just because of the approach. We're looking at treating the cause. What is causing it, as opposed to the symptoms. Medically, if I give you gabapentin and your symptoms go away, you're healthy. To which my response to a patient is, no, it's short term, it's made your symptoms better, but it's not going to continue to manage your problem because you still have the underlying cause. It's kind of like you get patients that are diabetic and they're like, well, if I take my insulin, I can eat whatever I want. Okay, so did that make your diabetes better? No, it didn't. And eventually that approach is going to catch up to them because their condition is just going to continue to get worse.
Well, I just looked over at our chat line. God, there's a lot of people in the chat line. Shane wants to know if someone is in a wheelchair, would it help them?
And unfortunately, that's a question I can't answer because I don't have the background as far as why they're in a wheelchair, what's going on. So that one, I'd be more than willing to do a phone consultation, talk to you over the phone so I can get some more information and maybe give you a better answer than I can on this platform.
That makes sense. Paul wants to know, what else could it be if presenting like neuropathy, but it's not?
We had touched on this just briefly before. It could be a pinched nerve, could be a bulging or a herniated disc, could be something related to diet, lifestyle, a metabolic problem. And again, those are all things that we dig into on the initial visit to try and figure out exactly, where your problem is coming from.
Jan wants to know if you take gabapentin. I hope I pronounced that right.
Gabapentin?
Can it cause seizures if you didn't have them before?
The best place to look for that would be to read into the side effects with gabapentin. I don't know that off the top of my head, but I know with every medication, long-term use increases the risk of side effects for the most part. And with gabapentin, I know on most of my patients, they start at a smaller dose and they just slowly increase the dose because the smaller dose doesn't work as effectively. So it could be, but that would be something I would have to look up. Again, and if you want to call me, Jan, I'll be more than happy to talk to you over the phone about that.
Let's give people your phone number.
The clinic number here is 262-246-3000. If you call us outside of business hours, just leave a voicemail, and either my staff or somebody will get back to you within the next day or two.
Well, it's pretty. This is your first show, and we've got about 3 or 4 more texts asking how come the show's not longer. But you know what? Dr. Simons is going to be back again with us next month, and what a great first show, Dr. Simons. We'll see you again next month. And we appreciate you coming on. This is such an important area.
Hey, and Steve, thanks for having me. I really enjoyed it.
Okay. Thank you, Kurt. That's Dr. Kurt Simons. He'll be back again with us next month. Thank you for all your questions. Thank you for joining our show. We're with you every week at this time. We'll see you all again next week.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.